The South African Health Department launched the Delamanid Clinical Access Programme for the treatment of multidrug-resistant tuberculosis or MDR-TB as part of initiatives to manage and treat tuberculosis in the country. Now, TB remains the leading cause of deaths in South Africa, accounting for 7.2% of deaths in 2015. It does kill more people each year than any other infectious disease, including HIV and AIDS. In 2015 alone, it's estimated to have killed 1.8 million people globally, according to the World Health Organization. Well, Mapaseka Steve Letsike is co-chairperson of the South African National AIDS Council and joins us now from our Hatfield studios. Good afternoon, Steve, and welcome to the SABC News Desk.
Good afternoon, and thank you for the invite.
You're welcome, Steve. This launch bringing new hope for TB patients in the country and a clear indication that the political will is there to fight this scourge, and it is being fortified with concrete action.
Indeed, we are seeing a great political will in South Africa. First, to say you recognize the leadership of the Deputy President Cyril Ramaphosa, who is the current chair of the South African National AIDS Council. But political will that has been mobilized was also across ministers or various deputy ministers, premiers in the provinces who leads the Provincial AIDS Council. But we also want to see this happening in metros, in district, but also in local level. We also see the leadership of sectors from civil society, including labor, including traditional leaders, traditional health practitioners, women, and also people living with HIV.
Steve, but the battle is far from over. Just quickly speak to us on some of the barriers to adherence when it comes to treatment and the impact of what you call intersecting issues of poverty, unemployment, and even the poor nutritional status of some of our communities right now.
Yeah. So I think, we need to first acknowledge South Africa still ranks number 6 in the world, and it makes it one of the 22 countries that carries the TB burden across the world. We also have seen quite a lot of TB cases, over 450,000 TB cases in the year 2015, which is a lot of cases, but it is also short. Where we see a declining, we are shorting the decline as of to 50%. There are quite a number of issues that needs to be taken in consideration. The issues around 63% of people living with HIV accounts for the TB incidents that was recorded again in 2015. But also sometimes not all people living with HIV are having TB, but also not all TB patients have HIV. So there are quite a number of things that needs to be addressed that drives the transmission, that drives the infection. Issues around poverty, which is very complicated issue that speaks to the economy in the country. But some of the issues that needs to be considered is the medical conditions, such as tobacco use, such as diabetes, such as silicosis, and poor nutrition status that exist. These are some of the things that needs to be addressed when we respond to HIV. In the National Strategic Plan 2012-2017, and this is a plan that will be launching on the 31st of March next week in Bloemfontein, which will be led by the Deputy President himself, we are calling for a robust interventions and integration of TB and HIV. So we are calling for decentralization of service, where we link health system strengthening to community system strengthening. So some of these issues can be addressed as it is called within the National Strategic Plan.
Steve, you feel strongly that tuberculosis should be confronted from a testing approach more than a screening one. Why is this, very quickly?
Of course, one of the biggest issues that we are experiencing is the issue around screening, which then becomes very late. One of the things that we believe in, if we are to test because we are using new technologies such as GeneXpect machine, and South Africa has 100% coverage of GeneXpect machine across the country itself. So if we are to ensure that we test rather than just only screen, that means we can reach patients early. Screening might miss some of the patients that needs to be diagnosed with TB. We all know that majority of people have inactive and most have active TB, and that's why it will be necessary that we test, then we can get new patients, and then we can diagnose in time. So for us, it's very crucial that while we do screening, but the most effective way is to look at testing more so to get patients early in time that we can administer the treatment.
Very quickly, we are running out of time, Steve. Take us through some of the key game changers when it comes to tackling this disease in South Africa right now, in context of our overburdened health system, that is.
So some of the game changers, and it's fortunate that, this past few days we have been talking critically of the game changers, including, as it has been noted within the National Strategic Plan. The integration, again, of services will be very crucial. Decentralizing the services, go to where people are, because you are dealing with patients, but you're also dealing with undiagnosed patients that are outside the facilities. We need a very strong social system that speaks to person-centered, where you look at relationship, society as at large as well. We need sufficient trained and competent human resource within facilities that will respond to the needs of patients, but also that will take care of the needs of the healthcare workers themselves. It doesn't mean that when we take care of the patients, the health workers are not at risk. They are vulnerable, and they are in fact key population. And very lastly, the two things, it's linking the health system strengthening to the community system strengthening. And we need a robust social mobilization. HIV has benefited, or HIV response have benefited from HIV movement. Definitely sure that TB can benefit for the same level of effort. One thing that we need to remember, a healthy economy will require a healthy population. And that's why we're calling for multi-sectoral response. And SANEC is committed for that.
Steve Letsike is co-chairperson of the South African National AIDS Council, joining us from our Hatfield studios in Pretoria. Thank you so much, Steve, for sharing your insights with us on the SABC News Desk.